Sorry, Paul. There you go. I won't interrupt again.
No, that's fine, Dan. First of all, I'll start with introduction, let you know who I am. My name is Paul Shadforth. I'm the Strategic Manager for SEND and Inclusion in County Durham. I also take on some responsibilities across the region as well, and help support the Director for Children's Services over in Sunderland to run the North East Network, or SEND network as well. So there's a couple of colleagues I think I know from the national networks as well on this or in this workshop today. I know this is probably not the right etiquette, or I'm hoping it will work because there's only 10 of us. But if anybody's got the opportunity to turn the camera on, it'd be lovely to see faces. But I really don't mind if we don't. That's okay. But sometimes it's helpful to see the odd friendly face on the bottom of the screen. Oh, hello, hi Karen, nice to see you. Oh, look at that, real people. It's made me feel really complete. Thank you. Excellent. Oh, even more Fiona. It's lovely. Okay. Well, thank you for that. So I can see whether people are drifting off or if they've had cake. There's some smiley cake faces there. Looks like somebody who's definitely enjoyed a bit of a break. I was asked to do a workshop, or to go through this workshop and to look at we were doing some planning for this event and saying, okay, well, what would be practical, what would be helpful? And one of the things that we were saying is actually we've really ventured into the digital world far deeper than we'd ever anticipated. I know a colleague in the council here had said that actually as part of our 10-year transformation plan, we're about 10 years ahead of what we'd anticipated in terms of use of digital and distance working. So it's like, oh, well, we've just been rocketed into the future as a result of this. So quite helpful. But we have been using it in very different ways and in ways that I never thought was possible. When we set up this workshop, or when we were looking at this workshop, the idea was to have a series of different examples from across the country, but we in collating that, but we struggled to get the examples. So what I thought I would try to do is just give you 3 sort of practical examples that I've experienced of in County Durham, and they are quite different in their use of data, or I say use of electronic digital practice, as it were. There's probably a proper word for it, and I'm probably not the right person to say it, but digital practices in Durham. And then at the end of each one of those examples is just pause for the work part of the workshop, and just to see if I can tease out some examples from other areas where similar things have happened as well. And hopefully from CDC's point of view and Dan's point of view, we can start to collate actually just what's been happening in innovative ways, and then we can share that across the country. So that was my hope for this afternoon. In the interest of freedom, if anybody thinks, oh, that's not for me, I'm off, then now's your time. But otherwise, we'll crack on with the presentation. Okay. Well, I haven't lost anybody, so there's something. That's good news. Okay, so the first thing I wanted to talk about, there are 3 areas I want to cover. One was about internal practices, and if it's a bit dry, the first one, it gets better as we go along, but that's essentially about how we've looked at using a different management system around a particular task, which has been helpful. The second area is about supporting our communities as well, or the SEND communities, and how we've done that. And then just a really practical example about a sort of an associated part of my service area within the county and how that's really stepped up. So we'll start off with the internal practices. And this is grown. I say grown. It's actually been a very helpful thing for us. E-bundling systems for the SEND tribunal service. If you just bear with me, I need to get, if I start looking off here, it's because I've got notes on this screen and it'll help me a little bit. So what's an e-bundling system and tribunals? Well, just as a quick sort of, tribunals haven't ceased over the period of time. They're still there, still working. They were working electronically across the country. They're working electronically within the North East as well. But actually, our legal processes and generally serving tribunals is quite a historic. That's probably the nice way to do it. Process in terms of pulling your bundles together, making sure you've got your evidence, and there's a lot of paperwork in there. There's a lot of administrative work. There's a lot of submissions and all of those sides of things, and that was clearly going to be a task for us, as nobody was able to get into the offices to do that task. So we went into there, as I said, with an existing SEND tribunal system, which was managed. It was a manual process. Actually, we had somebody who's is pretty much exclusively dedicated now to tribunals within our casework team. Although we get some legal advice and support, we manage most of that internally ourselves as a team, casework team that is. And actually, in terms of time and consumables being paper, ink, and other such things, it's really quite an expensive system for us to run. But actually, then we found out, well, hang on a minute, we've gone into this, we've got COVID, working from home, how we're going to get hold of these fancy multifunctional printers, etc. And how do we overcome that? And actually, what were the risks to us? So there was the organisational risk and concern. So if you can hear barking, I now have a desk dog, which is a new addition through lockdown. She's over here. She's on a bed, just chupping away at the postman. So I'm just going to shut the blinds so she can't see it, otherwise it'll all kick off. Right, that might cease the noise. She's all grumpy now, hoofs now. Yeah, so obviously there's risks to that. There's organisational risks and not actually being able to serve tribunals properly and creating delays in the system that we clearly don't want to do. So how did we overcome that? What considerations have we taken? There we go. So what we wanted to look at is a full management system around the whole process of tribunals. And we looked at an e-bundling system. So basically, this is it's like a case management system, but solely for legal work. And it produces all that work, it paginates everything, it goes through all of those different things, and does the work for you largely. Although you've got to put the input in, you can do it digitally, and it comes up with fully court compliant documents towards the end. It's able to link into our management system as well. Which is helpful because it does take a lot of the populated information from our casework system and start to auto-populate there, so it stops officer time in there. I said it will get better. This is the dry one, this one. And although we wanted to go there, we were prepared to go in the marketplace. We knew there was cost associated to this, but we started to look at, actually, is this a COVID-related cost? Is it a normal investment cost? Well, then when we costed up all of the consumables and the officer time that we would save into this was seen as a particular investor save type model. So we went in there, we've done that, and actually we've come out with a much more flexible system for us to use. The system that we did, so in the interest, and this is not a marketing ploy, I've not got shares in this system, so there are other systems available, is a company called iChem. As I say, it is a standalone package. It saves hours and hours of time, as I say before. It does fit in with tribunal guidance. The reason we knew this and we went with iChem is our legal team used it for different parts of the council services. Sorry, just a moment. Sorry, one of my daughters is locked out and the other one's now going to have to open the door. Who's in the bubble? This is all real life COVID management as we speak. The dog's going to lift up. Right, there you go. Sorry. There, there's the dog bark. Okay, so yeah, it allowed us to do all of that work, but our legal team was already using it, so we did have to buy that as an add-on system. As I say, it's a different way of using digital practices. We wouldn't have done it because of COVID. We've come out of it with a much more efficient system, and it's easier for us to manage. So that was our offer. This is our offer into the workshop in terms of a digital system that's benefited us. And as I said, I would leave it open for colleagues now to perhaps share some other similar systems or something similar that's helped you in practice. So I'm going to stop speaking now and hand over. Oh, is this just a pause? It doesn't have to be about tribunals. It's fine if we. Oh, hang on a second. Is that a hand up here in our group? Jane Seller.
Just to comment that I'm coming from a completely different background. So I'm a physiotherapist. I work in Wolverhampton, but I'm also chair of the National Paediatric Physiotherapy Organisation, which is called APCP. And actually listening to your presentation, which is really clear and I'm sure is really helpful, just highlights to me the differences and the challenges we've got in meshing together as a multidisciplinary team, because I was coming to this with my knowledge of what we've used in terms of communication with families and teaching exercises to, you know, maybe newly discharged premature babies with their at home with a phone screen balanced above their baby, and how we've managed to get those packages out. And in terms of the SEND and tribunal experience, it's really great that our local authority, which is Wolverhampton, they take a lead on this, obviously. But just one thing to highlight is that some of the things we can't integrate with. So the NHS is really, the system's really locked down in terms of sharing information, and so I'm hoping that we can continue to develop our practice that way, but it's very embedded that you don't share NHS information on a lot of systems. So we've got a hub for our EHCP stuff and we've still not got permission to use it. So most of the education staff feel like we're not doing our bit when we just hand a piece of paper to them with our report on.
Yeah, thank you for that, Jane. I mean, there are a couple of systems out there at the moment. We're looking at exploring one separate to this, where it's a multi-point case management system where you would get the opportunity through a web-based server to contribute that information through. So it would take some of that out, but I understand the data sharing elements and that automatic linking the systems is a challenge for us and a challenge for us as a system. I would imagine that this has been a court bundling system is not exactly in your field, but hopefully the next examples might be something and will help to share some of those other areas of practice. Okay, Helen.
Yeah, I'm from Calderdale. I have a multifaceted role, I think you ought to say. I'm the senior lead nurse for children and young people at Calderdale CCG, which incorporates case management for children and young people's continuing care, designated clinical officer for SEND. I chair the care education and treatment reviews, amongst other things. So we do, touch wood, have low numbers of tribunals, and they do quite successful in the mediation. We will have one that we've got a tribunal thing that's going to be scheduled for the end of March next year. So I've been scribbling notes down. We are really good at sharing information and ensuring the consent's all in the right places across the workforce, really. But I do recall the last tribunal that I attended from a health point of view. It was emails of bundles on PDF and turning things upside down, and it's hard enough when this is probably last year, so we're 12 months on and we are, due to COVID, working more creatively and remotely. So I'm going to go back to my area and see what the team do and whether we're still updating and whether a member of the casework team is still expected to upload documents, etc. Because I'm wanting to meet with them and quality assurance processes as well, so that would help me. So just a thank you from me, really.
No problem, and we'd welcome a contact if you needed any links or anything along those. That's fine. And we do only have experience with that one system, but there will be others out there. So. Okay, great. Thanks, Helen. Okay, I'm going to move us on. As I say, we have 3 points to get through, and I'm bang on time at the moment. So let's see how I ruin that. Okay, so we've done the group discussion. The second area, as I said, is I wanted just to talk about supporting families or supporting our communities, and some of the work that we've done on our local offer in County Durham. We were fairly fortunate. I say fairly fortunate to have gone through a review of our local offer last year, where we we suffered like many local areas, I think, in County Durham, where we had a local offer that had all of the content that you could expect to see on a local offer, that you'd want to see on a local offer. But from day one of taking up my post 3 years ago, 4 years ago, parents summed it up perfectly for me. Whereas they said, oh yeah, the local offer, it's great as long as you know what you're looking for. You can, as long as you know where it is. And I thought, well, it's not helpful, is it? You've got to go there to find the answers, and you've got to have a much more intuitive system that can support you through that. So we have been designing and redesigning as best we can from that day onwards. And as I say, we set up with this new local offer. Now, we've been transferring content and trying to update content on that local offer throughout that period of time. But COVID did offer us that challenge, that opportunity and challenge to say, okay, well, hang on a minute, this is our #1 communication mechanism, apparently, for SEND. How do we make this live? How do we work through this? What do families want? We maintained a good contact with our parent care forum from day one. How are you guys doing? You know, what can we do? How can we help you, etc. And hearing that through. And we also maintained a contact with our Send I Ask service just to get a sense of what are the nature of the calls that are coming through to you. What do people need help with here, because it's different at the moment. It changed overnight, it really did, and how can we meaningfully support? So one of the things that we did is we stuck up on our local offer webpage, and it's there for you to Durham local offer at any point and have a little look at it. These are all little launch pads here, and what you have is the third one along from the top: resources for children and young people, parents, carers, and professionals. And what we thought, okay, well, straight away at the front of this is a bit of a banner and a scrolling banner, and we said, well, let's update that and make it as home friendly as it can be. So it's not just about schools, it's not just how you get in, but actually how you entertain your kid, how do you look after the well-being, how do you support them in home, really thinking and challenging ourselves on that. So we updated this part of the system, and we went through a big advertising campaign using our social media feeds, etc., from the CCGs, from the County Council as well, our Parent Carer Forum, who I've got to say are far better at reaching out in that kind of context than we are. So using WhatsApp groups, using Facebook groups. As a big County Council organisation, we're just not agile enough. They were superbly quick on there. Sylvia, you can't hear me, is that right? Oh, is anybody else having troubles hearing? No.
I can hear you, Paul. So, has anyone else got any issues?
No, I can hear you
fine.
fine.
Very clear, Paul.
Sylvia, I don't know if there's something wrong with your computer. We'll see how we can go on that. But if everybody else can hear it, maybe at your end, and I won't be able to help there, Sylvia. Yeah. Okay. It's in the chat there. I don't know if there's anything that you could offer in terms of support. So, as I say, we wanted to go there, wanted to get that message out there. We learned very quickly, and still have that challenge to ourselves, is actually how can we be more agile? Our parents and carers and families clearly are using different platforms than we are, and we could instantaneously contact them through our parent care forum, which was helpful, but we need to look at ourselves there a little bit more. But let's just have a little delve in. Let's pretend that I'm clicking on that red button, that red target there, and what we saw, oh, this is probably a little bit small, I don't know if I can zoom in here, but when you click in there, you'll get sort of 4 core launch areas in here. So you've got your cognition and learning, your communication, interaction resources, social and emotional work as well, and your sensory and physical fields. Now, I personally think at the moment this is still a little bit professional heavy in terms of its language, and I think we probably need to think about how we present that a little bit more. But nevertheless, that's our current launch in there. It hasn't come up in feedback from families actually. So whilst I might be criticising it, nobody else seems to be picking that up. But you know, we're keeping that dialogue open. And if we click on there, so if we click on cognition and learning, we then move into a range of different things you can do, and they're broken into three zones here. So there's communication, interaction, activities for children and young people, things that they can do, okay? Communication, interaction, activities for parents and carers to do with the children, and actually some other resources for professionals. This isn't just teaching professionals, it could be early health professionals, social care professionals, and we've promoted that all the way through our teams to say, how do you work with families in this environment? How do you promote this piece of work as best we can to keep the kettle boiling, really? And then when you went in there, what we had is all of our educational psychologists and all of our teachers as well sit there. We didn't let them out of their virtual rooms, and we glass housed them to say, okay, let's collate these, let's go through this and say, you know, what's the resource? Do we think it's worthwhile? Do we think it's of value? We discounted a lot of things, but we found a lot of things that we felt were helpful. We quickly then started to give a broad description of what that covers in there, and then we give links off to those support services. So just a really practical ordering, I suppose, of that information on the local offer for families to practically use and support. As I've said, from our Send IS service, through our parent care forum, through families and through our social care professionals, the feedback has overwhelmingly been very, very positive. And again, something that we've ventured into for COVID. And then we've all sat down and looked at each other around the table and thought, why didn't we do that in the first place? Why didn't that just exist in this way? It's just a really practical way to go about it. But faced with a problem, you find solutions. This was one of ours. I said that I would move and pause at the end of each of these. Hopefully less, more supportive of other people's practice than just tribunals, but let's see where we've got from others. So Karen, you had something you wanted to share from South Tyneside? Oh, there's North.
Yeah, hi, it's Karen Horridge here from South Tyneside and Sunderland. It's really interesting, thank you. We're neighbours. Yeah, so one thing I got involved with before lockdown was with the Learning Disability Clinical Network across Cumbria and the North East. And we've developed a web app for families called Learning Disability Matters for Families. And this is freely available, anybody can access it. And what we've done during COVID is added in live additional resources, again, like you, to support families. So the app, it's a web app at the minute, but the actual app is going to be available, I think, either next week or the week after. And the idea is it's got loads of resources explaining what a learning disability is and isn't, where to get help and support, and specifically support around COVID like yourself. It's also got, which is really useful and people might want to look at, it's got a validated screening tool for learning disability that's been developed by Karen McKenzie, who's a professor of clinical psychology at Northumbria University. And she's published this tool. It's not a diagnostic tool, but it is a screening tool, and how I use it as part of advocacy for families who are earlier in their journey who feel that their child might have a learning disability and they want a bit more information to present to services to say, can we have a more formal look at this? Can we map against the SEND ranges, for example, as the graduated approach before getting to the whole education, health and care planning system? So if anybody wants to look at that, it's www.learningdisabilitymatters.co.uk. So lots of little snippets of multimedia in there if anybody wants to have a look.
That's great, Karen. Thank you very much. And Dan, I'm sure as part of the recording we can share that out with a minute. And nice to see a northeastern there. You'll know Nose's Point where I'm at. I don't doubt from where you're at. You could probably see it from Sunderland. So great stuff. Okay, Siobhan, I'm hoping I've pronounced your name properly. You had something to share?
Yeah, sorry, it's Chauvin, but you're right, because it's spelt Siobhan, so it's just me being awkward, so don't worry. I just want to say we've taken a similar approach, and you're absolutely right about the stuff around the parent carer organisations. Our local one is way better at quickly sharing this stuff, and we took the approach of doing a kind of a two-way thing, is that we just kept linking everything back and forth, so that if they happen to end up on the parent carer forum, they got the same information presented a bit better, honestly, but anyway, that's by the by. Or if they came to our local offer, they were getting the same. So that was really, really helpful, and actually it really helped us talk more and more and more with our parent carer organisation, just having to get on and do that quickly and flexibly. Not that we didn't talk to them before, don't get me wrong, but you know, it really helped, I think.
I think it's been a really interesting side of things, because a lot of our daily operational work is via schools on a day-to-day basis. So once you take that medium out, you have to think differently and quickly. And actually, you know, you then it's easier to co-produce when it's practical.
Yeah,
so you can co-produce solutions on a really practical basis. So thank you for sharing that.
And we had one bit I must just add that we found really popular was free stuff. I mean, I know a lot of the stuff is, but it was maybe things that normally you have to pay for, but that became free during COVID. I don't know, various symbol packages, and I don't know, there were various bits and pieces. And getting laptops and stuff, people really liked that section.
Yeah, well, and rightly so. I'm sure we all we've all contributed to Joe Wicks's hits over the period of time, and improved his stardom even further. So that's wonderful. Kieran, are you coming back in? No, Legacy. Okay. That's great. If there are no other comments, I'll press on and keep the time here. If you can hear my dog jumping, I'll introduce you to it before the end of the session, just to show that it's not. She's entertaining. She's quite famous in County Durham now. Okay, so distance teaching for vulnerable children. Where did this come in? Where did this creep in? So, as part of my service areas, or what I manage, I also manage the educational health needs team. That's what we call home and hospital in County Durham. So you'll be more familiar, I'm sure, with home and hospital. And for colleagues across all different sectors here, we've really noticed a massive change over the last 2-3 years in educational health needs provision or home hospital provision, where traditionally it would be a lot of ward teaching, a lot of childhood cancers, unfortunately, or other issues going on longer term hospital stays. Home and hospital provision came in, created an offer for young people that generally aligned itself to the rehabilitative process of whatever they were going through and back into school, so that they've got that bridge of learning and they get themselves into school. Over the last 2 or 3 years, to the point today where I can tell you now that we've got the highest numbers we've ever had, more than three times more than we've ever had previously. Sorry, not previously, but 2-3 years ago. And every one of those children are anxious school refusers at the moment, so clinically too anxious to attend school. That's I just thought I'd share that as a context at the start. Now, some of that anxiety is recognised as a special educational need. Some of it is actually associated with autism as well. And that's why I wanted to introduce it into this discussion today, because actually we'll all be facing this, no doubt. And actually COVID and great periods of lockdown is not exactly the most supportive to dealing with young people's anxieties and seeing them build that resilience and move back in. So we had to we run that teaching service. We traditionally do that through small group work and in community buildings and settings up to the point of getting them back into school. We start off in some instances of doing some outreach teaching on a one-to-one basis in homes, but always on that basis that we see them back into communities and back into their school community. This obviously threw some quite different challenges. So how did we engage with these young people? How did we go about teaching? What were our challenges? How did we get off to the right start? Well, the key thing for us on the get-go was actually how do we interface with families at this level in a safe way? So we had to go through all the licenses, the GDPR, the accessibility. We had to consider online safety as well. So actually not just the online safety of the student, but of the tutors as well. So if there was a young person, we're always encouraging the family to be involved in that call as well, that we've got recording in place if we're recording that session, just to make sure everything is nice and tight and supportive, as I say. And then we also challenge with the IT infrastructure in homes. We make an assumption, I think, a lot of the times that, I mean, people do have access to the internet regularly now, and they can use the Facebook and they can use the WhatsApps, they can use all of those packages really well and really proficiently, but largely they do it on that platform, our little phones a lot of the time, and families will see 4 of these devices but not a laptop computer, and sometimes just a tablet if at best. And a lot of our teaching and learning would require different infrastructure. Of course you can do it on a phone, but it's not always the most easy thing. So we're really quick with the IT scheme when it came in, and we tried to make sure that we've got laptops in the homes where we could see in our young people, our vulnerable young people, were quickly audited, and we managed to get those facilities in place. In terms of the licenses and GDPR, well, we had a real search around, and I I don't want to say anything to panic anybody or anything along those lines, but we heard of things like Zoom when we first started off, and everybody was, oh, use Zoom. Zoom's the thing to go for, and it seemed to be right. But actually, in terms of data protection, really sketchy, and how they record every piece of information and they reserve the rights to use that information at any point was really not in line with our GDPR principles. So we had to discount that very quickly. Google Classrooms has improved, but at the start of lockdown, it wasn't really up to the job for us. So we actually run a lot of our teaching through Teams. It's not always ideal because I think at first people were struggling following the link into Teams and getting the web-based launch from Teams. And I think there was an assumption that you had to have the hard version and all that business. But ultimately, that's how we overcame those things. We used Teams. We engage families in the online safety side of things. We use the record facility in there as well. And we made sure that young people had the IT infrastructure. First of all, now, what did we do? We got, in terms of some practical support and work for young people. There we go. So we wanted to keep in touch and keep things lively with young people at all points. A lot of this is about social contact for young people. So we produced a nice little newsletter with lots of different links and of interest, and some educational, some just interesting, you know, things that we thought were quite fun or helpful for young people. And we started to put them out there. We started to encourage young people to share their interests as well and their links through that newsletter, and try to make it something, as I say, just that common communication through with those young people. Now, that wasn't the only thing. I've used that as an example. What I had to do with my team on a number of occasions is try and rein them in a little bit, because they were, we're really concerned about them. So they're going around the houses. They were trying to teach them through the windows so they could knock and wave and make sure everybody was okay. You know, we had a nice summer, didn't we? So we were teaching in gardens. We were doing other bits and pieces there. But they really were innovative about how they create that interest and contact as well. But then the teaching as well, and what were we teaching? Well, we probably taught more science than we've ever taught. My science teachers are over the moon about that. But we started to really just try and make some practicalities of that teaching to engage families into it. So parents, and actually in terms of anxiety and building that resilience and strength, that was really beneficial for us as well. So we had a bit of a double edge there going on. And actually some really practical science examples using kitchens and using different household cleaning products and other bits and pieces to look at that. And that little photograph is the homework of one of the young people. So they would take the photos on they would share that with us, then share it with a wider group of young people, and some of them have little connection groups. So yeah, it was a really nice way of using distance learning and not being scuppered by the fact that they are at home, actually benefiting and flourishing from it. Now, one other example, and particularly this was for our older young people that were in there. So, you know, a lot of our young people will follow the pattern where the majority of the education health needs teams and the anxiety-based are young girls from age 9 up over, essentially. And actually what we find is that they're struggling with school, but they're going to college or they're going to university and they're flourishing and they do really well, but they're just struggling in secondary school. So we started to link them with wider programs of work that linked with further education and other such things. And we had this Durham University Citizen Science project where it's called Mammal Web, where we set these camera traps around the place. And this is Lily, and Lily's information is actually, there's a link here when you get the presentation, but I can say Lily because she's been in the newspapers and everything along those lines, and she got loads and loads of hits. She got loads of wildlife as well. There's nice pictures of Lily, but I didn't want to share them here today. And these are Lily's words, what she's found through that process. So bearing in mind that Lily is not untypical of a young person who didn't want to come out of a room at first. Okay, but now through lockdown, she could have stayed in that bubble and stayed there and quite understandably done so as well. But Lily's now speaking with the university, she's in newspaper articles, she's linking in with colleges and further education as well, and she's really out there and pushing herself forward. So it has helped us always with that sight on to say, once you've got through that operational element of engagement, how do you then transition that through into resilience and actually independence and engagement in the wider community as well, and build on those strength factors. So just a nice example that we're really happy with. So in our home hospital teaching, what did we learn really, really quickly for us? We're a big county. For those of you who don't know County Durham, I think a lot of people know the cathedral and they know the castle, and it's in Fulham Mill and all the prettiness side of things. That's a teeny tiny part of County Durham. It is an enormous agricultural county, and there's a lot of distance and a fairly low population in there as well. What we're able to do with this is we can cover distance really effectively. And I'm not just talking about tire and tarmac, I'm talking about up to 3 hours worth of teachers' time spent driving around between appointments. We can do this in a meaningful way. We would never lose that contact with families, but actually we can have a mixed offer and an augmented offer where we can use this to our benefits. And actually, I've talked about those family benefits. So families at first really want this and want us to deliver this. But what we have to do is make sure that if we do commit to doing this and we do this distance learning and this outreach learning, there has to be clear links to preparing young people for their adulthood. It can't be just a curriculum in home in the comfort of their own environment. Actually, it has to be progressive. It has to do that preparation work. It has to build their resilience, as I've mentioned before. And Lily's example is just that, is an example of how we've managed to do that. So that was my last share. And I hope what I've done there is showed you some fairly mundane internal things, some general, actually, how do we influence the community, to actually, how do we work with children and young people on a very practical basis? And that was what I wanted to cover. But I wondered if you had anything you would like to share in terms of how teaching or support, so it doesn't have to be teaching, it could be just how you're contacting and working with families at the moment, and how this is perhaps something that you take forward or what you would pick out of there. Yeah, I'm not going to be able to pronounce it. Probably, sorry, was it?
Oh, Chauvin.
Chauvin.
Yeah, don't worry.
Chauvin.
Mine
No,
it's just
okay,
something
Chauvin,
I don't work into. I work in social care, but it was just something somebody was telling me about this morning, and it's really, really practical and down to earth. But they were saying that kids who are back in school, some schools have been, whilst they're in school, doing stuff virtually in the school, teaching them how to do it in case we need to go there again, because, you know, we probably will at some point, won't we? And I know that's not a particularly innovative thing or anything, and it's fairly obvious, but it just seemed like a really sensible thing to be doing.
And I think everybody's at slightly different starting points on that.
Yeah.
We shared the Shadforth household here a little bit today, and although I've got my desk job and dog job and everything along those lines, I have two daughters, and one of them's just come back from school, who was let in by the eldest one, whose bubbles burst at the moment because she's in year 11, and she's struggling with that. Now all her classwork is set up, but it's been a struggle for them to get on. She was almost in for 2 days and then locked out at that point. And my youngest went in for a test, but got the confirmation that she was clear. And when she went in for that test, now what was quite interesting is she went in for that test and her learning stopped at that point until she got that information. Now the school are working on that quickly to try and make sure that if there is a break, that all those lessons are set through that distance model. Thank you. Karen, you had a comment?
Yeah, just a couple of things. I'm a paediatrician, so I've been doing things very differently during lockdown. First of all, I was moved on to the COVID rota, so onto the wards with very little clinic time, and that was really uncomfortable because I knew families still needed that ongoing medical support and management of epilepsies and things that aren't just going to disappear. So very quickly I persuaded our managers to let me do telephone clinics. So I had to invest in a decent pair of headphones because I was doing literally back-to-back telephone calls. And I didn't find video worked for a lot of families because you were kind of needed to contact them then. You weren't able to do a lot of setup. And families found, I think it was less intrusive to have a phone call. Some of them were at work or driving or doing the washing up. But we still managed to have that connection. The other thing that we've done virtually in Sunderland, which has been real progress, is all our strategic interagency working with disabled children. So I'm the designated medical officer for SEND, and all our strategic commissioning meetings and strategic planning meetings have moved to Teams, and that's worked really well. It's cut down everybody's travel time, like you say, because we are a big area. And we've had better attendance at strategic meetings, and I think have found better ways of working. So I hope all that continues. I'm pleased to be getting back to some face-to-face now, because some things you can't do. You can't do postural management for children with cerebral palsy very easily without putting your hands on, and a lot of children have deteriorated significantly. Of course, operating lists have all gone on hold, but things are opening up a bit again now. So I'm glad to be back to some face-to-face, but maintaining the telephone support where that is efficient, effective and proportionate. But I'm seeing all my new patients face-to-face, because you just don't get a sense of getting to know somebody, examining the child, working out what's going on without that personal contact. So that's a bit about what we're doing.
No, that's really helpful. I think one of the things that we've noticed is quite often with these young people, we had a relationship with them going into lockdown. So it was quite helpful to maintain that, where actually building the newer relationships is more challenging for us. So, you know, this was okay as long as we were building on something, but actually that foundation, that getting to know you, the trust side of things, that's, you know, we don't find that quite so easy, as it were. Jane, you had something to comment from the Royal?
Just to say that there's been the letter out, a Send newsflash saying that people who work within paediatrics in the NHS shouldn't be redeployed. But the feedback that I'm having from various trusts is that they're not really going to be able to comply with that, because they're also having the request to staff Nightingale hospitals and so on. So it is really difficult, because all of us on this call, we're devoted to Send, but actually our NHS organisations perhaps have got other priorities. And in Wolverhampton, we've returned to 75% of face-to-face. We're loving getting back to face-to-face, mainly because as physios we're so involved with children who have additional physical needs, and it has proved challenging. There's been some benefits in parents really trying to engage with the physiotherapy programs, and I say that trying to engage deliberately, because it is complex, and when your child is young and changing, we often put our hand over the parent's hand to show them the movements, and it's really difficult to do anything different. So I do fear that we're going to have another blow to NHS engagement with the process. Sorry.
No, well, I can understand entirely. It's a massively challenging period of time, and this is an example of where it can work. But I'm under no illusions that actually it's a fit job for what we can do at the moment with a particular cohort of young people. There'll be some jobs, like you're saying here, that it's just not as easy to work in a digital economy. You can't really do those things at present. So, and some of those physical and those highly skilled roles that you're mentioning there, I can see the challenges, absolutely.
I'm not saying we can't do it, because we actually can do it really successfully. It's just that in terms of clinical prioritisation,
Sure.
If you also have your workforce decreased, it gets very challenging.
Yeah.
So we all need to get behind the idea that NHS paediatric services need to still be prioritised for paediatrics as well.
You've got my support, for sure. Okay, colleagues, I think I might be actually on time for once, unless there are any more questions. I think we're about, is that right, Dan? Is that what we were looking at time?
Yeah, we're going to finish at 10 to. I mean, I was just going to echo one of your points earlier, that from another program that I work on, working with Send Information and made a similar observation around maintaining contacts with young people digitally is working well, but making those new and kind of initial relationships and gaining trust remotely is proving challenging. So there's no replacement for that actually getting out and those initial face-to-face meetings, which can then be maintained sort of in more innovative ways, if you like. Yeah.
So at the moment, I guess we're forced into that. But when we move into I say we're forced into, we're in a lot better position now, but we're anticipating further lockdowns over the winter and what have you, where that will be difficult for us, but we would always be looking to create those relationships and make those relationships on a face-to-face basis, but sustaining the work and keeping in touch with families. We can do a lot more of that, and we can be more efficient by using this model. So very helpful. Okay.
Right. Okay.
Well, wonderful. What happens now for colleagues? Do they move on to the next workshop? Dan, do you want to explain the next steps?
Yes, yeah. Well, I think you've got a couple of minutes if you wanted to run to the loo or put the kettle on quick boil. I think the next meeting starts at 5:02, so you should all have the links. So you've just got a 5-minute window to kind of get yourself in between the two meetings, and that will start at 5:02, and then that will be the last workshop of the day, and we'll all feed back at the main session after that. Is that all okay?
Yeah. Thank you very much, Paul.
Oh, nice to meet you and
Thank
see
you.
and hear from you all. Thanks for
Thank
that.
Thank you. Bye.
Thanks, Paul.
Bye-bye.
Bye-bye.
Chauvin? Oh.